Alzheimer's Advocacy Day at the Capitol, which brings together caregivers and advocates from across the state, along with organizations who are involved in caring for individuals with Alzheimer's, so that we can blend our voices together in support and to raise awareness for the plight of those that are battling these diseases.
Well, we have been saying in the field of social work, the baby boomers are coming, the baby boomers are coming. Well, they're here, and they are living much longer and are actually maintaining fairly good health. So because of that, we are seeing those cognitive problems morph. And so we know that right now, 53,000 Mississippians are suspected to have Alzheimer's disease or some form of dementia. But we know by 2020 that is going to double. And so those numbers are just going to get larger.
It is the sixth leading cause of death in the nation. The only one without a prevention, a cure. There's nothing to slow it. Economically, it is a huge impact. People live with the disease a long time, so you've got Medicare, Medicaid being affected. The caregivers that have to take care of them are being affected because they're having to take off work, lose work, that income. So financially, it does take an impact on the entire state, whether you're connected directly or not.
It is a disease that you can't explain it the way that it truly impacts the family, and especially the caregiver, the primary caregiver, whether it's a spouse or a child. Those relationships are strained. The loved one may disassociate them as another family member or not remember who they are at all, and so that can cause an increased anxiety and stress on the family dynamic.
The state plan is an initiative that was started and finalized in 2015. It's a blueprint and an action plan to help us to be prepared for the burgeoning number of individuals that are affected by Alzheimer's and other dementias.
That plan is actually patterned after the national Alzheimer's plan, and through those areas we're able to coordinate efforts for research and care coordination, caregiver support, public awareness, and brain health.
The Mind Center has been very blessed to have received funding for the past 4 years through the state legislature, which has really been a boost to our research efforts. And we're leading some of the most comprehensive studies looking at risk factors for Alzheimer's and other diseases ever undertaken. And so that continued funding is very critical to our efforts. So we like to be here to express our appreciation for the support of the legislature, and also so that they can help to make their constituents aware of the resources that are available in the state and the work that's being done to support them if they are battling these diseases.
I've got personal involvement with family members. I know that research is our answer. We have a golden tool right here in our own state with the research that is going on at the medical center, at the Mind Center. We have lots of research grants coming in, but we need the public. We need people to get on board. We need people who say, let's find it. There are too many people that are being affected by this.
Alzheimer's Association is a national organization that our main focus is research, so that we can raise money for research, we can find a cure. We offer support services to our caregivers, to the people that are living with the disease, early stage, support groups, community education awareness programs. We do volunteer, a lot of volunteers helping us with everything that we do.
I am very grateful to the legislature because they have always been supportive. They were supportive 20 years ago when they made the Department of Mental Health Alzheimer's Division. The Alzheimer's Special Care Units came out of the legislature. There are 12 special care units that were devoted to taking care of just Alzheimer's patients. There are now, I think, 18 all over the state, so that people can be treated in their own community. So they have been so supportive, and they continue to be supportive.
Alzheimer's Mississippi is an independent, state-based nonprofit. We focus on the state of Mississippi. We have over 40 support groups across the state. We hold 3 conferences annually, Central, South, and North Mississippi. Every program that we host is free to the public, and we think that it's very important that the public knows what resources are available and how to navigate this disease.
I am very optimistic about the future, and so we know that this reaches far beyond what we can do in one organization. But through that continued discussion and opening those doors of conversation, we're able to find, even today, of research entities and different projects that are happening that have similar vein in mind. And that's ultimately what it's about. It's bringing those resources together to expand the common good.